Molecular epidemiology of a norovirus. A norovirus are classified into 10 genogroups with group 1, 2, and 4. This is a group, it is infected to human. Group 4 is a predominant strain that is responsible for the most global outbreak which occur. Development of the virus is driven or occur by the point mutation and recombination, immunoselection, and genetic drivers. Molecular application. Now, molecular application is used for the outbreak investigation, source of tracing of the infections, and surveillance, monitoring emerging variant, and the vaccine development. Molecular technique is used for the in these all points. Whole genome sequences now it is help in phylogenetic analysis and the variant identification and the transmission what tracking transmission which occur in this outbreak. The outbreak investigation and infection control are common outbreak setting including a hospital or long-term care facilities and the schools and the daycare and the restaurant and the military crimes. So laboratory investigation involves or include the collecting samples of stool and performing PCR with genotyping positive isolated sample or conducting what or do an epidemiological tracing limnal infection. An infection control measurement, the main infection control measurement used to control infection including the patient isolation, contact precautions, الهاند البريكوشن اللي هي من الهاند washing with soap and water and the chlorine based environmental disinfection. الفود سيفتي measurement اللي هي required إذا عايزين نعمل control infection نعمل food safety measurement. والفود safety measurement بتبدأ معانا بنعمل excluding لمنول الانفكتيف food handler for at least 48 hours after symptoms resolution. It is important to note that ناخد في بالنا إنه يا جماعة أي alcohol based hand sanitizer are less effective because the norovirus is not involved and can resist all different type of this infection. These slides compare between a rotavirus and a norovirus. Several norovirus vaccine candidates are currently in clinical trials. حاليا في مجموعة من الفاكسين للنوروفيروس under development. From this table you can see rotavirus is the leading cause of the severe pediatric diarrhea and is a vaccine preventable disease. And norovirus is the leading cause of the epidemic gastroenteritis across all the age group and also responsible for trouble diarrhea. Rotavirus pathogens involve the NSB4 enterotoxin, whereas a noro disease result from the epithelial infection without the viral enterotoxin. يعني ما عندنا enterotoxin وين في النورو. A post virus is highly contagious and primarily transmitted by the fecal oral route. Here we discuss let's talk about another virus هو adenovirus أو enteric adenovirus. Enteric adenovirus الانتريك adenovirus belong to family called the adenovirus genus الماستو adenoviruses species of the human اللي هي F type 4 and 41. They are non-involved linear double-strand DNA viruses cause 5 to 10% of viral gastroenteritis cases infection worldwide, mainly causal infection in the children under 2 years in immunocompromised patients. They are environmentally stable في environment due to the absence of a lipid involved. عارفين ال non-involved virus اللي هي more resistant to the environment factor. A clinical feature of enteric adenovirus infection include prolonged watery diarrhea lasting for 5 to 12 days, vomiting, fever, few or mild abdominal pain, and dehydration. When adenovirus gastroenteritis usually has a longer duration than a rotavirus infection. Here we talk about another virus which we can cause a viral gastroenteritis اللي هي الأسترو والسابوفيروسز. طيب الأستروفيروس اللي هو non-involved positive single strand RNA viruses from the family called the Astroviridae family, causing mild to self-limiting gastroenteritis mainly in the children under 2 years. Clinical feature للأستروفيروسز اللي هي include الوتر diarrhea, vomiting and low-grade fever. Saboviruses اللي هي non-involved positive single strand RNA viruses from Clacoviridae family, causing acute gastroenteritis with diarrhea, vomiting, abdominal cramp and fever. Saboviruses increasingly cause the community and industrial outbreak affecting the children and the adult also. The difference between astro usually cause sabrotic mild disease, while a sabo associated with a more frequent outbreak and mild to moderated illness of the gastroenteritis infections. هنا this is the comparison. This is table compare between الأسترو والسابو virus اللي هي different age group. هي هنا الأسترو infect the young children والسابو infect the children and the elder. Severity الأسترو mild, هنا السابو ممكن تكون mild to moderate. outbreak less occur in the astro but it frequently occur in the sabovirus. This table compare the general feature of the major viral causes of gastroenteritis, including their structure, epidemiology, clinical feature, and diagnostic method. This comparison help you in the diagnosis and the examination and the control of the infections. The host immune response to enteric virus or gastroenteritis of viral gastroenteritis. The host immune response involves multiple components. طيب الإيمون سيستم هيتعامل كيف مع الانتريك virus infections؟ طيب innate immunity include first develop innate immunity which develop against gastroenteritis viral infection اللي هي including gastric acid, intestinal mucosa, tight injection, and abdominal gut microbiota as the first line of defense. After that, cellular response involves some macrophage, dendritic cell, and natural killer cells اللي هي بتعمل recognize the infection and initiating antiviral immunity. الهيومرال immunity الكي سايتوكاينز اللي بيحصل لها developed هنا هي الانترفيرون جاما، انترفيرون الفا او بيتا، والتيومر نيكروسيس فاكتور الفا، وعندنا الانترليوكين 6 وانترليوكين 8 بيعملوا لنا inhibit للفيرال replication and recruitment للimmunocytes. After that develop the adaptive immunity. Start with the humoral immunity اللي هي produce ال IgA security IgA at the primary mucosal defense. After that the IgG provides systematic protection. Developed also cell mediated immunity with a CD4 helper or CD8 cytotoxic T cell contributed to viral clearance and immunomemory to form an immunomemory against this infection by this virus. Mechanism of diarrhea in the viral gastroenteritis. There are different mechanisms contributed to diarrhea in the viral gastroenteritis. Electrolyte destruction first may be by electrolyte destruction cause malabsorption and automatic diarrhea. Volus atrophy reduce intestinal surface area impairing nutrient and fluid absorption. بعد ذلك بيحصل كروب للسيل هايبربليزيا، بعد ذلك بيحصل لنا replace الدمج electrocyte with some immature cell بيعمل لنا reducing digestive enzyme activity، وبيحصل increase في الكلورايد secretion especially في حالة الرطب through ال NSB4 الانتيروتوكسين lead to secretory diarrhea. بيحصل delayed في الجاستريك emptying contributed to the nausea and vomiting. والclinical consequences لكل الميكانيزم اللي بتحصل دي انه lead to dehydration, electrolyte imbalance and metabolic acidosis and الويت loss. طيب الفيروس shedding and transmission. طيب الفيرال الفيروس shedding اللي هي before symptoms onset before symptoms onset continues during acute illness. طيب الفيروس بيحصل له shedding قبل ما symptoms يحصل لها onset و continues during acute illness and may persist after clinical recovery for a long time. The duration of shedding is different according to different viruses. Rotavirus up to 10 days, فالنورو من 2 to 4 weeks, Astro اللي هي 1 to 2 weeks, Sabro variable, and الادينوفيروس for week. الفاكتور we see enhancing and transmission اللي هي انه في low infectious dose, high viral load, environmental resistant, asymptomatic, carrier, poor hygiene and contaminated food and water. All these factors it is help in the transmission of the infection from one person to the another person. The clinical manifestation of the viral gastroenteritis, the clinical course is usually acute and self-limiting, lasting 1 to 7 days. The severity of the infection depends on the viral pathogen and age, and immune status and nutrition, the status and degree of dehydration. Well, symptoms of gastrointestinal infection including the acute watery diarrhea, nausea, vomiting, abdominal cramp, and anorexia. Asymptomatic symptoms including low-grade fever, fatigue, headache, malaria, and the typical disease timeline, exposure, incubation period included from 12 to 72 hours. After that developing and vomiting and watery, and then بيحصل لنا شنو بيحصل لنا recovery. Illness may be more prolonged and severe in the immunocompromised patient. Because why? Because the viral infection depends on the immunity system. There is a differential diagnosis of the viral gastroenteritis. The differential diagnosis include infection causes such as a bacterial pathogen including Salmonella, Shigella, Campylobacter pathogenic E. coli, Vibrio cholera, and Clostridium difficile. Parasitic اللي هي الكارديا والكريptosporidium والانتايبو والسايكلوسبورا, الفيرال روتا والنورو والادينو والاسترو والصابا. All these microorganisms can cause a viral gastroenteritis. We need to do a diagnosis to differentiate which type of microorganism which cause an infection. And non-infectious gastroenteritis infection اللي هي inflammatory. إذا patient عنده inflammatory bowel disease أو عنده celiacal disease أو عنده lactose tolerance أو food poisoning أو drug induced diarrhea, irritable bowel syndrome, appendix or bowel obstruction. All of these infection cannot transmitted from one patient to another. A red flag suggesting this is the not viral gastroenteritis إنه لما يكون في blood diarrhea, that means not viral gastroenteritis, a high fever grade with severe localized abdominal pain with symptoms lasting more than 14 days, marked ويكون في increase في leukocytosis or signs of sepsis. All of these signs it is lead to what suspected this is a bacterial infection, not viral infection. And how we can diagnose this infection? The best sample collected for diagnosis of this patient is a fresh stool collected during an acute phase. Collection guideline اللي هي at least require 5 to 10 gram in sterile leak-proof container, avoiding contamination, labeling correctly, and transporting directly to the label. Store from 2 to 8 centigrade if proceed within 48 hours, or at minus 70 degrees لو احنا هنعملها use after long time. This minus 70 centigrade used for a long time preservation, avoiding a repeat freeze cycle. يعني نطلع وندخل من الثلاجة. دايما بنحافظ maintain الcold end during transport لأن الفيروس is very sensitive and may be killed. And use a viral transported media when indicated. So if suspected is a viral infection, we use a viral transported media to transport the sample. usually follow a standard biosafety precaution include the gloves, laboratory coat, the eye protection if splash risk exists, and the proper waste is possible uh, for this sample. The main objective or the main purpose of the laboratory is to assess disease diversity, to assess disease severity and dehydration, to assess electrolyte disturbance, and to exclude the alternative cause of the diarrhea. Complete blood count may show leukocytosis and the hemoconcentration due to the dehydration. السيرم electrolyte هنلقى فيه increase في الصوديوم والبوتاسيوم electrolyte البايوكربونات with the common abnormalities include الهايبرناتريميا والهايبوناتريميا والهايبوكليميا والميتابوليك acidosis. هنلقى فيه found the renal function test we do renal function test. هنلقى فيه increase في اليوريا والكرياتينين والسيرم كرياتينين سجلت انه dehydration related to acute kidney injury. Also we can use the C-reactive protein والبروكالcitonin to help differentiate the bacterial infection and the blood gases analysis in severe dehydration patient. Also we use to investigate it or suspected acidosis. All of these tests we can do in the lab to evaluate what that patient or diagnosis of the patient. A conventional laboratory diagnosis for gastroenteritis infection, viral gastroenteritis infection. First, we do antigen detection method by using ELISA, lattice agglutination, and immunochromatographic. Usually this test is the most important test because why? Because it's rapid and easy to do in the general laboratory, commonly used for the viral antigen detection in the stool. Primary, all these techniques are the primary use for the rotavirus and the adenovirus type 4 and 41. الادفانتج include being rapid inexpensive. الحاجات المميزة ان التكنيكس دي مستخدمة انها هي easy to perform, suitable for routine or point of care testing. A limitation of these techniques, it is a lower sensitivity than molecular technique and PCR, especially with a low viral load leading to possible false negative result. Molecular assay دايما مفضل when a higher diagnostic accuracy is required. There are different methods for molecular diagnostic technique we can use for the viral gastroenteritis. All these methods depending on PCR, which provide high sensitivity and specificity for detecting genetic enteric viruses or multiplex GI PCR panels اللي هي used to detect multiple gastrointestinal pathogens from a single sample of the stool. When next generation sequencing and the whole genome sequencing are used for genotyping, molecular epidemiology, outbreak investigation, and phylogenetic analysis, surveillance, and monitoring emerging variants. Major advantage of this molecular technique اللي هي include the highly diagnostic accuracy, detection, low viral load اللي هي and the rapid round time اللي هي سريعة جدا في استخراج النتيجة, and support the public health surveillance. But it has some limitation. It is a high cost, need specialized equipment and trained person and bioinformatic expertise اللي هي زول متخصص وين في تحليل علم الجينات. This table show a general comparison between a different laboratory diagnostic method, application بتاعها والadvantage والlimitation for detecting of different enteric viruses. Treatment. How we can treat the viral gastroenteritis? The management of or treatment of viral gastroenteritis mainly or primary depending on supportive treatment. اللي هي is a primary supportive, not treatment, as you know that the virus have or generally viral gastroenteritis has no specific antiviral therapy for the most viral gastroenteritis infection. التريتمنتس الجول بتاعنا، الهدف الأساسي بتاعنا يكون maintaining the dehydration, replacing the electrolytes, controlling the nausea, vomiting, preventing a complication and reducing the transmission. WHO recommended use of oral dehydration solution with the first line for the treatments which used for the moderate dehydration. Intravenous fluids such as a normal saline and lactic ring solution used for severe dehydration or persistent vomiting or shock or alternative constituents. Symptomatic treatment, we can use a different type of the drugs which are available. Antibiotics are not recommended because viral gastroenteritis is not improved by the antibiotic, because they are ineffective against the virus as general antibiotic and maybe promote antimicrobial resistance and clostridial deficiency infections، وبالتالي ندخل في complication تانية بتاعت bacterial infection. Prevention and infection control of viral gastroenteritis. The prevention is the most effective strategy for reducing the burden of the viral gastroenteritis because the treatment is mainly supportive and specific antiviral drugs are not available for the most endemic virus. The first and the most important measures is personal hygiene. Personal hygiene اللي هي including what? Include washing the hands with the soap, water for at least 20 seconds, maintaining a proper toilet hygiene, avoiding food preparation while it is symptomatic, while handle food or handle food maker it is have symptoms. Food safety involves the cooking food thoroughly, washing the fruits and the vegetable. نعمل washing الفروت والvegetable prevent the cross contamination and use a safe drinking water. Environment control، نعمل control الانvironment، بنعمل cleaning للarea and use a different type of disinfectant to contaminated area with a chlorine based disinfectant. All the health care setting implementing different precaution. Start from the isolated of systematic patient and use the dedicated equipment when possible. Ensure إنه الانvironment عندنا it is clean in the hospital. Public health measures اللي هي دي related to Ministry of the Health اللي هي strength outbreak reporting وsurveillance والhealth education and access to safe access to the safe water and sanitation to all population in the environment. Recent advances in the viral gastroenteritis 2024-2026. In this final scientific section, we will review some of the most important advances in the viral gastroenteritis research and laboratory diagnostic between 2024 to 2026. One of the most significant development is the improvement of molecular diagnostic technologies which used for diagnosis of these patients. اللي هي molecular diagnostic continue improving by using a multiplex PCR, a digital PCR, CR, ISBR based test اللي هي whole genome sequencing now widely used for the outbreak investigation, surveillance and monitoring viral develop. And there are the several norovirus vaccine candidates will be developed under clinical trial. Also use an AI now. It is increasingly used for the outbreak prediction, genomic analysis and laboratory data entry. All these advances, different technique is improve early diagnosis and the surveillance and disease control. In this slide, you can we summarize the different characteristics of the 5 major viruses responsible for the viral gastroenteritis and provide a useful comparison for the revision from these lectures. Also, in this slide, this is final slide summarize the most important concept from today's lecture. Viral gastroenteritis remains one of the leading causes of the acute diarrheal disease worldwide and continues to be a major public health challenge. Side improvement in the water and vaccination and personal hygiene. And vaccination is an important point to develop to control this infection. The most important pathogen which can cause viral gastroenteritis اللي هي الروتا والنورو والانتريك ادينو والأوسرو والسابو viruses. Each of these viruses have a unique biological characteristic, but all of them is similar in the mode of the transmission. Thank you. That is all for the viral pathogenicity or the viral gastroenteritis.